Hello, and thank you guys so much for joining me on our first ever episode of the Smart Start Recreational Therapy Insights by SMART CEUs Hub, and I'm your host, Nathan Lamaster, the owner of SMART CEUs Hub. Well, whether you're a student, you're a seasoned professional, or simply curious about the amazing field of recreational therapy, this YouTube show is geared to provide all things recreational therapy. So we're going to go into things that you can share with your friends, your family, customers, to things that are meant for the professional to either improve what we do, to learn about various trends in the field, to learn about goals, possibly licensure initiatives, etc., that are happening in the field. But this is our 10th year anniversary at SMART CEUs Hub, so I felt it was about time that we got on YouTube and we started providing content to you in this form. So thank you guys so much for coming. If you could do me a favor right now and like this video and subscribe to the channel, we'll make sure that you get these videos every single week coming up on your feed so you can check out what's new, what are the new topics. Today, we're going to start with the very first episode, and the topic being, I feel like this is the core one that we need to discuss, is what is recreational therapy? So, your friends, your family, those that you meet, and they ask you, what do you do for a living? You say, I'm a recreational therapist, and they're like, what's that? So this will be the video to help you describe what you do in a concise way with some examples. So, recreational therapy is often referred to as RT, therapeutic recreation, or rec therapy. It is a healthcare practice that uses purposeful recreation activity-based interventions to help individuals improve their physical, mental, emotional, social, and spiritual well-being. This is not an exhaustive list about examples that I'm going to give you, but I've come up with a few for every single domain so you can see how recreational therapy works in these domains. So in a physical rehab setting, so a lot of rec therapists work with OTs, PTs, speech in the physical rehab setting. And you might be wondering, what does a recreational therapist do in that setting? Since OTs work with activities of daily living, physical therapists work with gross and fine motor skills, speech works with cognitive and swallowing, and what does a rec therapist do? So a rec therapist might address a physical need in that setting based off of, like, for example, somebody having a stroke. And they might use a seated balloon volleyball game to address getting cardiovascular activity, increasing range of motion, coordination, hand movement, fine motor skills, and having a wheelchair or a seated position helps provide stability and safety while encouraging active movement. So you have this protective foundation for you to be able to work on these things. So as you know, somebody with a stroke might lose use of their whole right side, and it might be, I can use my left hand, but maybe the goal is to eventually start using the right hand and building that muscle up. So they might not be able to move it very much, but over time you build neural pathways in your brain, which will actually, it's called brain plasticity, which will actually help improve that movement, that brain activity that will happen through repetition. In a psych setting, so a lot of rec therapists actually work in behavioral health, we actually might do a guided journaling and discussion group. And they might write about their thoughts and their feelings in a structured format. They might have prompts. So like today might be, okay, what are you grateful for? What are your challenges that you are facing? What are some coping strategies that you've developed that could help you to address the daily stress, depression, anxiety, substance abuse that you've been facing? and then coming up with those goals for that group. Right? Cognitive. So just like we talked about earlier, somebody might have a stroke and they might lose their use of words or have difficulty problem solving after their issue. So a cognitive rehab strategy might be a game that involves memory and sequencing. It might be a board game, for instance. A simplified board game or card matching activity designed to challenge attention, recall, and planning skills. This fosters cognitive processing and problem solving in a fun, low pressure environment. So a lot of times, rec therapists, what we do is we provide activities that are almost deceptive in a way, because we are making it fun for the client. They might not know that they're actually improving something. So back when I worked in physical rehab and we had a patient who had a stroke, we were playing chess, for instance. And for them, everything from their middle plane to the left was blank. And so they had part of their pieces on the left side of the board. And what they had to do is they had to learn how to reach past that center plane after their stroke to be able to grab those pieces and do the movement. Or, for instance, being able to identify pictures on a card. So maybe if they had aphasia, like they think in their head they're saying the right word and what's coming out isn't the right word, you might be working with them on those flashcards and learning to say the right word again. In a social skills realm, we might do a team building activity, a ropes course. It could be a community outing. It could be a scavenger hunt that requires participants to communicate, form groups, form leadership, be able to problem solve, group think, and have positive social interactions. So maybe somebody's social skills are lacking due to a disability. Maybe they haven't had much social interaction in their life and don't do really well with working with others. So the goal would be to help them to improve that skill. This is a necessary skill for life. Spiritual. So this is an area that a lot of people are like, how does recreational therapy help spiritual? So in a hospital setting, I know when I worked in behavioral health, somebody might be a Christian, and during this emotional distress that they're facing, they might want to get closer to God again. They might want to form a closer bond with their Father in heaven. And so the activity might be to create an art piece inspired by a meaningful passage to them in the Bible. It could also be organizing a chaplain to come see them, or going to a service if your hospital has a chapel, or even if they are not Christian, a mosque, like if they're Muslim or something else. Your goal as a recreational therapist is to give them that well-being so that they are in the optimum headspace for while they are healing. To appreciate where we are today as rec therapy, it helps them to know a little bit about our past. So the concept of using recreation for healing has been around for centuries, stemming out of World War II, where we had the American Heart Association had recreation workers. Okay, and Florence Nightingale, the same person who actually is the mother of nursing, was also the mother of recreational therapy. So she viewed that recreation and leisure played a vital role in improving the well-being of patients beyond just giving them medications and going to groups and therapy and all those things. So this is a needed part of the whole person. So over time, RT became more organized and was recognized as a legitimate healthcare profession. I mean, there's a lot of history that goes into the different organizations and philosophies that guided how we grew into what we are today, which we'll talk about in future episodes. But currently, we are clinically and community-based. So we have two areas of rec therapy, and ATRA, which is the American Therapeutic Recreation Association, is our standard setter for what recreational therapy is. They are the national membership organization for recreational therapists, and they advocate for us to legislature. They try to get bills passed. They provide all types of continuing education opportunities, all around great people. And then we also have a national credentialing body called NCTRC, which allows us to have safe practice. So somebody is a CTRS, Certified Therapeutic Recreation Specialist. They have had to pass an exam and being kept up with a continuing education for recreational therapy to be able to practice as a recreational therapist and call themselves a recreational therapist. And that's what NCTRC does. Why is RT so important? Because it's inherently holistic, guys, right? People aren't just one thing. There are a lot of things, and they need a lot of things to be healthy and to have purpose and meaning to their life. In RT, that's what we do. That's the cool thing about us. We get to help people discover what that is. I know I've been talking for a lot right now, and I'm going to kind of wrap this first episode up. Thank you again for coming by and for watching this first ever episode of the Smart Start. Hopefully this content, even though it was more on the basic side, is going to be useful in at least how you talk about rec therapy to others, and explain what we do. Obviously share this video with your friends, your family on social media. For those that you feel need to know a little bit more about our field, if you thought it was any good, like and subscribe so you get these videos again every single week. But I'll give you a little teaser about what's going to go on for week 2. We are going to be talking about the core competencies and credentials for a recreational therapist. So now that we've defined what recreational therapy is, we're going to talk about what it is you have to do to become one and be competent as a recreational therapist. So if you found this episode helpful, please come on back again. And I look forward to spending time with you next week in another episode of the Smart Start Recreational Therapy Insights. Again, my name is Nathan Lamaster from SMART CEUs Hub, and I will see you next week. As always, recreational therapists, stay classy.